So I talk a lot about hospice for a really good reason. It's an amazing benefit. I have some videos on some of the good stuff about hospice that I will link here. But today I'm just going to talk to you about hospice and how you access it, because I talk about it all the time. I need you to make sure that you understand how to access it. So we're going to talk about how you access hospice care today. My name is Abigail. I'm here to normalize these conversations about and education about death and dying, so we die better at end of life and things kind of life and death. Let's get into it today. How do you access hospice care? Well, it's really interesting. It's actually become easier and easier to access hospice care because it is a medical benefit that is part of your insurance, most insurances. Medicare obviously covers it, but a lot of the private and also commercial insurances also cover it. You can also pay out of pocket if you're if you are undocumented or you don't have insurance for some reason. But most people in the States are insured to a degree, and hospice care is a benefit of your insurance. If you need information, more understanding on that, look up your insurance and just go ahead and give them a call, and they should be able to tell you what that looks like for you. And not just hospice, but also palliative care. And they can both kind of be accessed in the same way, but I'm focusing mainly on hospice care today. So to access hospice care, I kind of consider it mostly like two ways. Way number one is you get a referral for hospice from your doctor. Maybe you went in to see your oncologist and you got some unfortunate news that they're no longer able to do any additional curative treatments because the cancer is more advanced. Or maybe you ended up in the hospital, or a loved one ended up in the hospital with a very serious illness or a serious fall, some other type of event that is really impacting the length of life they have left to live. And, from there, the physician there will put in the referral to hospice. And then what happens there is then you have a bunch of hospice providers that are, responding and maybe working with the hospital, and then, getting in contact with you after the hospital has maybe got into contact with you. Sometimes you'll hear directly from a hospice company itself after it got a referral from your physician's office or from the hospital, because they may say, Dr. So-and-so did put a referral in. Just make sure it sounds legitimate. There's so many people out there now with scams. I don't think that there's that many people scamming in hospice like that. Hospices are doing other different things that they, we're constantly trying to ensure that are being regulated and are being done appropriately. But just make sure it makes sense. If they say it's from Dr. So-and-so's office, go ahead and call Dr. So-and-so's office and make sure that that is in fact correct if it's the first time you're hearing from them. But here's the other way that you can access hospice that is also very user-friendly to you. Because hospice is often ordered too late, and you're just getting the sense that, you're seeing a lot of changes in your loved one, things are really going downhill, they're falling more, they're maybe having more confusion, maybe with their dementia, or they're just not thriving with their cancer treatments or whatever treatments for MS, whatever it is. And, they're also maybe elderly, for example. Most of our hospice patients, at least when I worked in hospice care, they were geriatric. They were of geriatric age, but, there are also younger hospice patients too. And I never had experience with children. That is a completely different type of care. And I will probably at some point get someone on here that has had specialty or some specialization with children and infant hospice at some point, because that is a very specific type of hospice care that I do want to make sure to cover at some point for you all. But most of this time, I was dealing always with adults and mostly people of geriatric age. So, especially when we're considering comorbidities, other type of existing conditions, along with a more advanced age, then, you have the capability to, especially as a loved one of your, of this person, if you're starting to see things go downhill and you're having conversations with either your loved one or you had conversations, hopefully with them in the past, that they have a certain idea of what quality of life is to them, and they want maybe a more natural approach to their care. If things are not really progressing with their curative treatment, then you yourself, your loved one, or you yourself, if you're a patient, can contact hospice. You need to make sure that it's within the area that you reside. Okay, so if you're living in one state for, this next month, you need to make sure it's within that state. You can always, if you're moving, you can transfer to another hospice. Of course, you can do that. They can actually work with each other with the transfer, especially if you need certain things like oxygen, things like that. Okay, so you can contact a hospice care provider directly. You go online, you go on your phone, you're looking for hospices near me, and you can start calling them, and you can, talk to someone usually within minutes, and say, this is my situation. My mom has been just going downhill really quickly, and I just want to know if I can have a hospice evaluation. I've got Medicare. My mom's got Medicare. I just want to know if I can have a hospice evaluation and just talk to, somebody from your team about this, because I just have a feeling that things aren't going well. Or I've been getting cancer treatments. I'm just not doing well. I'm having a lot of side effects. I'm really thinking about stopping cancer treatments. Can you have someone from your team come and talk to me and, see if I'm possibly qualifying, what this means for me and my treatment, and how we can ensure I can be comfortable, especially if I stop treatment. I really want to make sure I don't have any more issues with my side effects, and that I can be comfortable once I stop the medications, my chemo, my radiation. And I just want to enjoy my last, few months here on earth. Instead of throwing up and having all these mouth sores, I want to be able to enjoy some foods that I like and enjoy some time with my family and just be really comfy at home. The hospice they will have to verify insurance and things like that, because they need to ensure that you are in fact insured. But they should never, ever say that, oh, it's going to cost this much money for us to come to evaluation. Evaluations are always gratis. They're always part of something that the hospice team will do, because they are there to evaluate. That's part of your benefit, to have an evaluation on the house, okay, basically. And you are entitled to that evaluation and to a conversation and some more education about hospice care and what it specifically means to you. And most often it's a nurse that's going out there. Sometimes it's a hospice representative that's also very knowledgeable in hospice. You can request for a nurse, especially if you have real specific medical things that you have questions about. You can. If they end up sending someone who's not a nurse and a hospice representative, it doesn't mean anything bad. It just means, and don't poo-poo that person that's coming out, because they're a hospice professional. They can give you a lot of information. But at that point too, they can also get the additional information from you, have a nurse review it, and then a nurse can call you. Or, if things look like it's appropriate for hospice, the nurse can just come out, have an additional conversation with you. And if you're like, yeah, let's go forward with it, get some consent signs and get hospice care started right away. The one thing I need you to understand about hospice care and accessing it is it is supposed to be very accessible to you. Hospice care, when you look at the rules under Medicare, how they formulated all these rules and regulations and other, these regulations also for other insurance companies, hospice care is time sensitive. That kind of makes sense, because if you're dealing with end of life, you're dealing with time and time sensitivity and time sensitive issues, right? We don't have a lot of time to dilly-dally. Hospices, and I will speak personally from my hospice, we were just used to, if a referral comes in, we were on it. We were on it right away. There were some cases where I really don't want to deal with this until the end of the week. There's nothing emergent going on. I just don't want to deal with it until the end of the week. I have Thursday off, and then I also have Friday off. So I just need a day to relax. And then Friday I can meet with some people and talk about my aunt here who's sick. And that would be a really good day to meet. But hospice teams are supposed to be, staffed, and usually are staffed with people to go out same day. Go out, that morning, that afternoon, that evening, to address a potential hospice referral. So if you have questions, if you're really panicky, and if you're thinking mom is getting sicker, dad is getting sicker, uncle's getting sicker, and they may need to go to the hospital, and you're talking to your doctor and you're like, hey doc, I just think I want to stop the treatments because this is not how my dad wanted to live. We had these conversations. He was really clear and he is just not looking good. And realistically, what do you think is going to happen if we go to the hospital, and the likelihood of him continuing to respond to chemotherapy and radiation? And you have to really ask those questions and be really detailed with it. That'll be a separate video for sure. But this is just how to access hospice care. So bottom line, to access hospice care, it's so easy to go on these other roads because everything is so intertwined tightly in this subject. But to access hospice care, number one, you can get a referral from your doctor. But if you're concerned about a loved one or you yourself, you are always allowed to, with your insurance, allowed to call and talk to a hospice and ask for an evaluation and see if there is, see if you may qualify, your loved one may qualify for hospice care. Let me know if you have questions specifically about this subject or anything else, of course. I'm happy to answer them. I read every single comment and just really want to make sure that you get the information that you need. And let's continue normalizing these conversations and education about death and dying so we die better at the end of life, and continue to create and cultivate meaning in our lives until we get to our death, because it's going to happen. All of this is temporary, and let's make the most of it. I'll talk to you soon.